Welcome to the Los Angeles Tribune page. Here you will find original news programming, exclusive digital events, and shows that are directly from the community. At the Los Angeles Tribune, we believe in giving a voice to the voiceless. We are proud to be the only national brand to empower everyday people to make a difference. Since 1886, our reputation has been built on truth and responsibility. Thank you for watching and making a difference.
For general inquiries, contact today. Thank you on behalf of the Los Angeles Tribune team.
Welcome to a celebration at the precipice of time, where the power of women knows no bounds. Experience her story unfolding, a reawakening of our collective consciousness to the monumental achievements of our foremothers, a tribute to the battles they fought, rights they've secured, and paths they've paved that women all over the world are continuing to navigate and expand upon. Her stories are unfolding, empowering growing, building legacies of pioneering women by sharing their stories, celebrating their accomplishments, and embracing the rights and privileges they've bestowed to us for generations to come.
Welcome to another day of Her Story Unfolding, honoring women's legacy past, present, and future. And today is a very important day because today we talk wellness, health, and honoring women in the medical field and in the industry, especially, with regards to cosmetic surgery, gynecology, and all that. And Alicia, I would love to ask you, how excited are you for this segment today?
I am so excited, Ava. To our guests, thank you for tuning in to another broadcast of Her Story Unfolding, where we honor and celebrate women every day in the month of March for Women's History Month. Ava, I'm so excited to bring our guest for today's show on, Dr. Adrienne Lara. She is a woman that has really taken a perspective and a voice within the wellness and the healthcare industry. She is a gynecologist, she is a cosmetic surgeon, and she speaks empowerment and wellness. And we're just really excited to dive into super, super important topics for women's when it comes to reproductive system, their body image, how they feel about themselves, and finding your own voice and trying to get to as she's grown along her journey. So very, very excited to bring Dr. Adrienne on today.
Absolutely. And, we wanted to just, whether you're watching this live or watching this on recording, we invite you to share it. And we also invite you to ask questions even in recording, because Dr. Adrienne Lara is someone who's very attentive to questions and she loves questions and is very responsive to that. We will also be sharing a way for you to contact Dr. Lara at the end of this session, at the end of this segment. So keep watching. Dr. Adrienne Lara, we welcome you on stage.
Thank you so much. Aisha, you got me excited, okay? I'm really glad to be here. And you talked about asking questions. Please ask questions. It takes about 12 years to become a doctor. And we used to like to say that we spent 12 years learning the answers. Please ask us. Yeah.
That's amazing.
Absolutely.
So Dr. Adrienne, we shared a little bit about your bio, but we know you do so much. And we always say on our show, we can share your bio, but we would love for you to share more about you in your own words. So please share with our audience a little bit more about who you are.
So I'm a Harvard-trained obstetrician gynecologist. And before that, I was a nurse for 10 years. I grew up in California. I'm the oldest of 9 children in a Mexican family. And when I started med school, I was 30, and I went to Boston for medical school. I went to Boston University School of Medicine, and then I was accepted at Harvard to train. So I trained in OBGYN, and then I stayed there for 10 years teaching. And I taught residents and other doctors and medical students, and it was just great fun. I think my gift in life is to teach, and my dream in life is to teach. After that, I came back home to California, and I worked here with a a center that I opened, Celebrating Women's Center for Health, Beauty, and Wellness. And I do GYN and OB. And then I was diagnosed with cancer and I had to segue. I couldn't still do OB, getting up in the morning and on weekends. So I segued and pivoted the practice with the help of my then partner to a MedSpa, because we had to pay the rent. And so the MedSpa, we started doing liposuction and injectables and radio frequency. And it was wonderful. I joke with my patients saying that I got every machine that I wanted to use. Then we segued into sexual medicine for women, dealing with dry vagina, painful sex, lack of libido, or difficulty with orgasm. And we do vaginal laser and other treatments for the vagina. That was wonderful. And now the latest thing that I'm doing is during COVID, I was able to pivot once more. And I took a 2-year fellowship in cosmetic gynecology, but more importantly, in stem cell and regenerative medicine. This was in India. And I got the chance 2 years ago to then go to India and finish up my hands-on studying and training. And then I got to speak at the Congress there. So that was a real delight. So now we're at the point, I'm not supposed to use that SC word, but we're at the point where we're developing that area of my practice more. Regenerative medicine is really the new frontier in medicine. And it is something really exciting for me because it's still being developed as a specialty. I guess the only other thing I would say to you is that in all the years that I've been in practice, and next year will be 30 years as a gynecologist, that I've always felt that I have the practice that I think women deserve. And I tell patients that what I do is I set up a collaborative partnership. That's what my patients and I do. We're in a collaboration to optimize their health, their beauty, their wellness. And I give the options. I never make decisions unless it's death or cancer. I will push a decision. The decision is yours. Your body is the greatest gift you ever got, and your health is the cherry on top. And so that gift of you is something to be loved and protected and taken care of.
Absolutely.
Wow.
And you know what's amazing, Dr. Lara, with your specialty is that you've pivoted so many times that you pretty much have the spectrum covered. Holistically, you can really look at a person and from different sides of the specialty, really be able to collaborate, with what's best for every woman in front of you. And I hear from your voice that every woman that sits in front of you is an individual, not just a number, not just a file, not just a chart, right? But I hear from your voice and how you practice that you celebrate women, like with the name of your center, right? Celebrating women. And that's so precious. I'm really excited about that. Alicia, let me pass you the mic.
Yes, it's beautiful that you celebrate women, and your body is your greatest gift. It is our greatest gift, and it's really important. And as you all can hear, this is why we could not read Dr. Adrienne's bio, because she has done so much and has supported women's health in so many ways. Dr. Adrienne, you mentioned that you were in a family. There were 9 of you siblings growing up. What was your experience like growing up, and how and why did you decide to go into medicine and women's reproductive medicine gynecology? It is a long time of schooling. What was your experience like growing up, and how did you end up in medicine?
Oh, thanks for the question. I was smiling because you said, how is it growing up in a family with 9 children? I was, all I could think of is we all had to share the bathroom all the time. Anyway, it was wonderful. My parents, my dad had been picking strawberries and my mom was 16 when they got together at 16 and 19. And they said every child was a gift from God. So I tell them they were very blessed. The one thing there were a couple of things that they taught us. And I think this is what drove me in that direction. The first thing that they taught us, we were never allowed to say, I can't. If we were asked to clean up the house or to help out or pick up things and we said, I can't, my parents would say, you never say I can't. So we grew up with the feeling and the and the saying that we can't say I can't, but you can do anything you want to do if you put your mind to it. At the age of 8 years old, I got a very interesting vocation, sitting in a hospital waiting for my dad to come out from surgery, and I was sitting alone. And when the nuns came up and took me all around the hospital, I just went with her. And she was showing me surgery and showing me x-ray and showing me lab. And she sat me down, and she said, you know, Adrienne, you could be a doctor. And I was 8 years old. And to this day, I believe she was my angel, because from the day I met her till all the way through my future, I would say at 8 years old, I'm going to be a doctor. I'm going to be a doctor. I had no idea how I was going to do it. When I told my parents, it wasn't like we were born into that family with doctors. They said to me, we'll pray for you. You know, so that was my vocation, and that's why I became a doctor. The basic reason, and I think this is true of most, I would almost say all doctors, is that they all want to help people. You wouldn't go through the strenuous training and education if you didn't have a commitment to doing some good in the world. It's too much. You'd go be something else. And so when I went to, this is a funny story, when I went to BU, Boston University, we were taking rotations, and I had always told everyone, I'm going to be a pediatrician. I love kids. I'm going to be a pediatrician. And I did my rotation at Boston City Hospital, which is like one of the first hospitals in the United States. It still straightens up backs when you say it. And I was taking care of kids that were drug runners and got shot in the thigh, that were kids of heroin users and got deserted at the hospital. I had patients that really couldn't afford the kind of medicine that we were telling them they needed. And I was in the call room, and the resident said to me, he was from New York, he said, not for nothing, eh? He goes, but you shouldn't go into pediatrics. And I asked him, why not? Why not? And he goes, because you cried every day. Every day I cried with those kids. And I was quite true. He said to me, children are never going to change. They're not going to be able to tell you what's wrong. And then when I went on my OB rotation, I said, oh my gosh, I found my tribe. They're happy people for the most part. We're very happy, very cheerful. I like to say we are the Disneyland of the hospital. We're the happiest place on earth there. And that fit my personality. And the other thing, as an obstetrician gynecologist, you get your surgical subspecialty, and I love to operate. I have really good hand-to-eye motion, and I love to operate. But beyond that, you set up a relationship with a woman. You just don't see them, and that's it. My youngest patient is 9 years old. My oldest is 93. And I get to see the gamut of women for a length of time. Certainly during their obstetrical care or their prenatal care, I have them for a full 9 months. So relationships are made. I could never be an emergency room doctor where you would have them come in and then never see them again. So it was easy. Surgical subspecialty, women, I love that. I'm a very big advocate for women, and I love the fact that you could have a relationship with your patients.
Wow, that's so beautiful. And your journey to going into OBGYN, it was a journey, you know? And I love the message that your parents gave you at such a young age. Like, and I would love to spend some time there, right? Because when you think about mindset and the will to succeed and to continue through challenges and to overcome them, that comes from somewhere. So what was that experience like, maybe when you were going through a challenge and you had to think about what your parents said and kind of navigate around that?
You know, the other thing that I didn't tell you, besides not saying I can't, is both my mother and father, now there were 9 of us, my mother and father said to us, they said, your education, the most important gifts we give you are your education and your religion. And they said, they said things like this because they were post-world. They said they can put you in a concentration camp, they can put you in jail, they can beat you, but they cannot take your religion and they cannot take your education from you. And so that's how important. They might not have been able to afford us, you know, cars when we were 16 or whatever, but they were able to afford us what they thought was important. And it served right in the family. 3 of us are doctors now, and everyone has their advanced degree out of all 9 children. So it worked. Wow. So I always thought that, you know, my parents had given me a gift. So that was kind of a legacy that I needed to keep going. But again, when it's hammered into your head, but I'm really saying it in a good way, that you can't say I can't. You just become a little warrior. And first you're an education warrior, then you're a doctor warrior, and now all of my women are goddess warriors. And I don't mean that it's difficult and it's a battle. By warrior, I mean someone that's very strong and unrelenting and determined, and takes their strength and winds it into power and makes it something strong about them. And I strongly believe that every woman has that in them. I believe that we have even the genetic makeup to be so powerful if we're just supported to go there. And I have the ability to see into the patients I see. I can see a vision of their power, I think, without getting woo-woo. I can see a vision of their power and try to be a reflection of that. So with my patients on a personal level, I try to reflect back to them what I see about them. And it's worked pretty well during the years, in terms of being able to encourage women to become who I think they're capable of being.
Wow, that's so beautiful. And being able to see into your patients and really connect with them.
Mm-hmm.
You mentioned that you like to be a GYN because, you have the ability to work with your patients long term. And when they are childbearing, rearing, you have the ability to really be with them throughout the 9 months. What roles has relationships kind of played in your own life, whether it's friendships or colleagues or individuals when you were going through the schooling that was long? And what role have relationships played in your life?
Well, okay. The first thing that comes to mind is that about male-female relationships. I hate to say this on Global Network, but in terms of those relationships, a man and a woman, romantic relationships, that's what I was saying. They've been there, but I think the better relationship I have is with my practice. I get more fulfilled at work. I'm happy to come to work every day. I get to meet women like you, Alicia. I get to work with them and talk with them and treat them and help them. And it's like meeting a whole 20 interesting people a day and having discussions with them, and actually maybe in a little tiny way affecting their life. I mean, where else do you get to do that? I used to say, where else on earth do you get to know someone intimately, both emotionally and spiritually and physically, in 15 minutes? It's such an honor to be a doctor, such an honor. I don't take it lightly. In terms of relationships, the second thing I thought when you asked that question is, I didn't really have any mentors. And I have always looked for mentors, growing up, but they're, maybe because our background, I don't want to say we're poor, because none of us thought we were poor growing up, but I know we were poor growing up. But I think, and the fact that there were not a lot of women in medicine, even when I went, the fact that there were not a lot of Latina women in medicine. There are a lot of older white males, which was what the being a doctor was about at that time. And I think it was difficult to have any mentor, and I never did. So I relied heavily on myself for encouragement and for strength to keep pushing forward. And there were tough times. There were times that I would lie in the call room at Beth Israel and say, oh my God, how did I get here? I don't belong here. There was a lot of that kind of questioning your worthiness. And I think, I did it, so I'm open to saying it. I think all women do it. We question our worthiness and our deservedness. And I think it's natural to do that. You're questioning yourself when you do that. But my goal or my wish for every woman is that they work through that doubt and they get to a point where they love themselves and they feel that they're worthy and deserving of anything. I believe that self-love is the basis for all healing in the world.
Oh, absolutely, Dr. Lara. You said it so beautifully. Self-love is the basis of everything, right? Like, we cannot pour out of an empty cup. You cannot give what you don't have. And oftentimes we give from our own, what's the word for it? Like, from our own life source,
Yeah,
and so
our own energy, yeah.
Women end up like really depleted and serving from a place of dysfunction, I would say, even, and lack, right? So self-care, absolutely, and self-love is truly um, the answer to a lot of our dilemmas. I wanted to bring back the question, Dr. Lara, to your experience, um, in medical school, being a Latina woman, quite unusual to, to accomplish the breadth and and wealth of accomplishment that you have being a Latina woman and in a male dominated industry. What was that like for you to navigate that?
Well, I started medical school. I graduated in 1990. And so prior to that, I started medical school. I was not only that, and it was such a treat. I tell people I'm part Jewish because BU, Boston University, is a Jewish medical school that was set up by the philanthropies when the Brahmins at Harvard weren't allowing Jewish people in, and they set up the medical school. So I was in school with a lot of Jewish people, and I love ethnicities. I love culture. So that was great. In terms of the medical school and getting through it and being a Latina, I would tell you I was the only Latina in my class, and that was in the 1980s to 1990. And so this is a great story. I joined the minority business group, in minority medical group, that was a support group in medical school, and they were all African American. And together we would try to raise money. And it's really funny. One night I came up with an idea to make money, and we were going to have taco days. I said, I'll cook all the meat, I'll chop all the lettuce, we're going to have tacos. And some people didn't even know what tacos were, but we made a lot of money. So it was integrating myself despite any differences. And I think that's what you need to do. Instead of feeling so different, embrace your difference, your diversity, and blend it in. Don't stop being you. And believe me, there were days where I tried to fit in and it never quite worked. And I know why now, because I wasn't New England. I wasn't the conservative type thinker that a lot of people on the East Coast are. And so I blended in my own way. And the way that you blend that way, or the way that you integrate that way, is with you. You drop all the labels, you drop even the female label, you drop the label of Mexican, you drop the label of poor, and you become you. And that actually is the essence of what relationships are, if they're authentic, is to be you. And so that worked because I went to medical school for 4 years, and I'm like, I'm only staying here for 4 years. I don't like shoveling snow and raking leaves, that sort of thing. I'm going back to California. So I applied to California and I applied to the East Coast, never thinking. And they have this big deal of match day where you go to your mailbox and you bring it out. And I started screaming and screaming. I go, oh my God, I got into Harvard. And there was no question that I was going to stay in Boston another 4 years. And it wound up being another 11 years. So 22 years out there. And it was my home, so I love Boston. I love the East Coast. I love the thrill of having been educated at Harvard. It was just, it's the medical mecca. And it was so titillating and so fascinating. And, it was wonderful. I will always cherish the time I spent there.
I'm having this giggles and goosebumps with just the way you describe how much enjoyment you have and how titillating it was to be in there. The person that would have a lot to say about this is also from Boston, Alicia. It's also from Boston, and she is, and she just moved to California. I'm giving all of the deets in here. This March.
Alicia, where'd you grow up?
I grew up in Hyde Park, so I'm from Boston, and I am definitely an East Coast individual. I went to undergrad Cornell, so upstate New York, and then I got my MBA in New York City, but I would always go back to Boston. And I spent a lot of time at BU, actually, because I played in the Boston Youth Symphony Orchestras. I played the cello, and we practiced at 855 Commonwealth Avenue. So I was right there.
Oh, my God. Well, I know Hyde Park well. The first place where I went to work was Roxbury, and at Roxbury Community Health Center. It was one of the first health centers in the United States, which had been established to give access to care, so that under one roof you had radiology, pharmacy, pediatrics, internal medicine, obstetrics, all under one roof. And I spent 3 years there right out of residency. It was probably one of the most meaningful practices I've ever had, was there with the people. I saw a lot of everything. And I even worked there with women to help to boost their self-esteem. Like in the women's clinic, I was like, how come there are no mirrors in here? And so I went out to Kmart and I bought a bunch of mirrors to put in the rooms so that they could kind of print and, see themselves. And then I also, it was just a door and you opened up on people. And I just thought that was so rude. So I had, I had the engineers put in there was a curtain. I had them put in curtains in all the rooms. So you had to go through a curtain to get to the patients. But my favorite thing is I got a Polaroid camera, and the pregnant women I took care of, I would ask them if I could take a picture. Some of them broke down and cried, and someone said, no one's ever taken a picture of me, or I haven't had one since 3rd grade. And I was going, oh my gosh, this is deeper than I thought. And so I'd take the little snaps and give him to him. And one of them said really shyly, can I have another one for my baby daddy? And I go, oh, of course, of course. The cutest story was then one of the pregnant women I had taken a picture of came back. She said, Dr. Lara, would you take another picture of me? I go, sure. She goes, I went down to Filene's basement and I got a pretty broad panty. And she had, to this day, I remember it had little cherries on it and she wanted to pose. And I would always tell them, wrap your hands around the belly and look down at that baby that you already love.
That's so beautiful. What I hear that you made and do make your patients feel seen. You make them feel seen with the mirrors that you put in the spaces, with the pictures, really help them nurture that self-love and that self-care. You are a gynecologist and there's beauty in being able to create life, but there are also a lot of challenges when it comes to a woman and her body and her reproductive system, whether it is having fibroids or PCOS.
I love PCOS.
Or blood clots, or not being able to have a child, or having a miscarriage, and how do you navigate that, or getting pregnant and you didn't expect to be pregnant and you're not sure what to do next. What are some of the things that you have shared with your patients as they've navigated maybe the challenges, the other side of reproductive health it is challenging and can be very limiting?
Well, I've always supported them. I'll tell you a good story because you mentioned miscarriage. So in the emergency room at Beth Israel, we had a whole side of the emergency room that was dedicated to gynecology. And oftentimes you would have women pregnant and bleeding that would come in, and we were able to do a D&C, which is cleaning out the uterus right there if they were having a miscarriage. And so we did it one time to a woman, and she came back to the hospital and she asked for her baby. Now, she had been about 8 weeks pregnant. Of course, there was no infant formed. And what we do is we suction out the contents of her uterus and then send them to pathology. Pathology checks, make sure there's no abnormalities, and then they discard the remains. And she said, no, I want my baby. And we said, well, we disposed of it. And she goes, I didn't give you permission to. That was my baby. And we said, it happens automatically. Well, it shouldn't happen automatically. She went all the way to the state legislature and said that it was her baby and that she should have a right. And it won. She won her case. And from there on, we would have to, when we had a person who miscarried, we would have to have them sign a consent that said, you can dispose of the remains, or you can give them to me in a jar, or a container. Because a lot of women wanted to say goodbye. They wanted to have a ceremony. And I thought that was so respectful. And I think that while I was there at Beth Israel, we wound up, that grew into another program about support groups for miscarriages. And I know that a lot of times I think it's the most lonely loss in a woman's life is when she has a miscarriage. She's already told everyone about it. She's so excited. And then what do? I mean, they're going to notice you're not pregnant, but do you call every person that you told and tell them the baby died? No, it's a very lonely experience. And so we actually started doing more programs and recognizing that, because women were coming out of the woodwork and saying, I had 3 miscarriages and I never talked about it. So that was really important. In terms of infertility, we were talking before the spot, Alicia, about egg freezing. I was trained at Boston IVF, which is the #1 infertility center in the nation, and one of the first ones. And not only was I trained there, I was also a patient there as I tried to get a second pregnancy out of this body. Unsuccessfully, 3 miscarriages later, we decided to stop. But the point is that I learned a lot about infertility for women. And I remember the last day that I went to my doctor, and he said, well, that's about it. We tried, it didn't work. And he goes, so thanks for being a patient here. And I looked at him, I said, that's it? I go, excuse me, I don't feel like I'm infertile, and I don't feel like that's it. And is there anyone I can see? Because I'm going through some kind of, grief right now. I'm feeling lost. And he said to me, Adrienne, that's a really good idea. Why don't you start a group? And it was like, there wasn't a group. And I said, listen, I feel like you're drop kicking me to the curb. And the other thing is this, I will not believe I'm infertile until I go through menopause. So I'm going to hang on to that because I need to. And so it was something that I thought was very, we have more women. I have a lot of friends who are now doing REI, reproductive endocrinology and infertility. And it's different now, but those were the days. And so that's something that I think needs support when it doesn't work. When it does work, they call them miracle babies. To me, every baby's a miracle, and so I think there needs to be support for infertility. And I think we do have a degree of that now. As to freezing eggs, women are delaying childbirth, and rightfully so, because women are advancing in ways that advance them personally, career, traveling, things women are now taking their own adventures into hand. And that's really great. I was actually on a panel at Northeastern, and the panel was women's role in the year 2000, because we had turned centuries. And when I did the introduction, I said, the good news is women have more choices. And the bad news is women have more choices. So I think more so than the other gender, I think we wind up juggling a lot more roles that we play. And I also did a talk to a business group about life-work balance. And I basically stood on one foot and I said, how long can I keep this balance? That's about how long we can keep balance in life, because life does happen to you. And so, and I think the tasks are more broad scoped for women. Men do such strong, wonderful, intelligent things, and they are wired, and this has been studied, to be linear. And what we do is we look wide, and that's why we're more maternal. So they are the providers and protectors, and we are the nurturers. And so that's what we see as our role. And it's not something we can change, really. It is who we are. So we have to look to work within that. That goes back to something Ava said. Ava said that we nurture without self-nurturing. 2 things I'm going to say about that. That's very true. And in my practice, women begin about 47 to start saying, I do liposuction surgery. You know what? I want to do something for me now. It's time for me. And they'll come in and do that because the kids are grown. And it is, at least they get to a point of self-care. What is enhancing about that is that the younger women who were raised by people like me are really taking their life into their own hands in a way that I didn't see my generation do. And they're not so eager to get married, have children. And that goes back to delayed childhood. And so they're learning from women. You talk about female history, just look at your own family history within it and look at the women, how they've evolved in your family, and you can see your own history and how it works, because you see exactly what history is. You see the forefathers or the foremothers and what their strengths were, what their positions were, what their morals and ethics were, and how they influenced all the way down to where you're at now. It's a beautiful legacy. I don't know if women always know that, but by virtue of being a mother, or by just virtue of being a woman who is related to other women, we have a legacy that we don't often talk about because it's not seen in newspapers or buildings or, publicly. But every woman has a legacy, every one of us.
Oh, that's so beautiful, Dr. Lara. I would love to really dig more about how your perspective on women's legacy, because that our heart at the Los Angeles Tribune, when we declared that we're honoring one woman a day, past, present, and future, is to honor the legacy of women. Realizing that when we did the Special Thought Leader Edition newspaper, and we really dug deep. Here's the graphic of the newspaper, but we really dug deep on the contributions of women to our society, and found that a lot of women were not even recognized for their contributions in the past. Maybe because contributions
100.
wasn't or recognition wasn't a part of culture of those days, other than Nobel Peace Prize or big awards. But a lot of women's work were not recognized, and so our goal was to be able to highlight a legacy from the past, and also how that torch is passed on today, like with you, Dr. Lara, and how you're living your life and how you're creating that legacy for the future. But what I love about what you said is that all of us, by virtue of being a woman, already has a legacy. Would you speak more into that, Dr. Lara?
I'm sorry?
I said, would you speak more into that?
Okay,
that by virtue of being a woman, we have a woman's legacy already that we carry.
Yeah, if you and a lot of it is by influencing others. If there are children or our nieces and nephews, or it has to do with teaching. We do a lot of teaching, and teaching, as you know, from the teachers, from doctors, any teaching you do creates a legacy. It's that old adage that people do listen. They say that they don't remember, like children don't, but they do. They have you in their head. Don't think that your words have not been heard. So we do a lot of teaching. I was thinking today about legacies, and because of the show, and I was thinking, in terms of history, I almost feel, without denigrating or demeaning the past, because that's where we come from, but it's almost like we're starting a new history for women. We've kind of turned a corner in a way. I mean, we have a long way to go, and I won't argue that, but we have a beautiful independence and support group of other women who have struggled to become who we want to be. There's no one telling us we can't go to med school. No one telling us we can't vote. No one telling us that, only men do that. It isn't to the chagrin of men. Believe me, I love men. I have a 30-year-old son, and I just think they're wonderful creatures, and as we are. But separately, women need to feel that they alone can achieve. And so I think that right now we're at a good place where we're growing in that direction. And that's why I think, maybe we're starting a new segment of history now, where women are a little bit more independent in their thinking and their acting. And in terms of legacy, you're right. You don't know if it's just because a child or a friend or a niece or someone dresses like you. I had a patient in inner city Boston, and she was, I loved her. She was so sweet. She wanted to be a nurse. But she was 21 and had her third baby. And so I kept talking to her about, you can do this. And then I changed practice. I left Roxbury and went into Jamaica Plain. And I went to practice there, and I didn't forget about her, but it was about 4 or 5 years later, she came to see me at the office. And I said, "Hi, Lily, what's up?" And she said to me, "Look, Dr. Lara," she showed me her diploma, and I still get chills. And she had made it through school because she learned to believe in herself. Not because I told her anything, but because she learned that idea that I can do anything. I'm capable and I'm worthy. And so that's the legacy that we can give to other women, is to tell them is that you can do anything you want if you put your mind to it. And I don't want to put down men at all. Sure, they can bench press more, and they have, they think linear, and I wish I had a man brain sometimes, but you know what? I'm just talking about women right now. And so that story was to illustrate that given a little direction, and that's what we do as women. We give direction, we give counsel, we give praise, we give nurturing, we give teaching. That's our legacy, and it's not to be overlooked, Ava. It's not to be overlooked. We don't have to find a cure to cancer to have a legacy.
That is so powerful, Dr. Adrienne. Um, even like the way you say, when you're teaching, you're leaving a legacy, to realize that the impact of women in our families, our children, our communities, our church, wherever we are, we have a voice wherever, and, even talking about voice, like to use that voice, but whenever we could use our voice, we are creating legacies. And that's so powerful to be present to that. So thank you. Thank you for that, Dr. Adrienne. I would love to give you, the stage, Dr. Lara. What would be a message that you would want to land to women in our audience today? And it could be anywhere from all of your realms of expertise. But I would love to hear, what's the message? What are some of the messages? Because I'm sure you have more than one that you would want to land to our audience today.
I hope you're not asking about Dr. Lara says you're pink, plush, and pretty. Okay.
Or you can take this any direction, Dr. Lara.
Okay. I know I don't want to be all serious about this, but I do want to say there's a couple of things. One of the things is that the word doctor is from the Latin etymology, and it's from Dr. Ray, and that means to teach. So that is inbred in us as doctors. I told you, we spent 12 years learning the answers, but if the doctor doesn't teach you, I'm not being a good doctor. So that's to teach. So I love to teach. The other thing you were asking about are messages. I have those serious messages, so they come to mind right now. And I guess the message that I want to give to women, and I do give to women in the office, is that there's only one you. There's no one in the whole wide world. What are we, 7-8 billion people now? There's no one like you in the whole world. That alone should empower you. And there's only you to be you. So yeah, it sounds kind of cheesy, but be the best you can be. But more than that, take a hold of you, own it, love it, use it, find out what it can do, and be that person. And health is one of them. Health is really important. Health is what is the basis for being you, I think, because it helps you to live the life that you deserve if you stay healthy. So it's very important to stay healthy. It's very important to see your doctor every year, although a lot of us don't. It's very important to check in with your doctor so that you're being monitored for anything before it happens. I'm the most guilty of that. I wasn't feeling well. It was about 3 years, and I thought it was just stress until I went to my doctor and I had a test for anemia. And my doctor called me the next day and said, "You need to get to the emergency room right now. You are so grossly anemic. How are you still working?" And I go, "I can't go to the emergency room. I have 20 patients this afternoon. I'm not going." And she said, "Are you bleeding? Where are you bleeding from?" "I'm not bleeding right now. It's got to be your bowel." That was on a Tuesday. On Friday, I was in for a colonoscopy. I was told I had very severe cancer. And by the next Friday, I was in surgery and having to find a way to keep my practice alive. I had not gone to the doctor. I had not gotten a colonoscopy. I said, I can just do those little cards in the office, and they didn't show anything. And so, I know firsthand what can happen if you don't honor yourself. If you don't honor yourself, say, I'm good stuff. I'm really good stuff. And I'm going to take care of it from head to toe, inside out, that sort of thing. So I do tell my patients that they're goddesses. And to me, I call them, how Gaga calls her fans little monsters? I could never do that. So I call my tribe, I call them goddesses, because to me, it means you have goodness within. And all women do. I think we really have open hearts for the most part. And being a goddess simply means that you have goodness within you, and find that goodness. Every one of us has it, even if you don't believe in yourself having it. There is goodness there. It's been put there by God, and it's inside your body, just like your health is. So find it.
Dr. Lara, you have goddess events, right?
Yeah, we do.
You do some goddess events. I saw that in some of your in your shares and posts. Tell us about your goddess event.
It's on the theme of goddess, and we're debating doing them anymore because I have a new theme. But goddess gatherings is what we'd call them. And we would talk about, I would bring people one goddess gathering, they were the third Thursday of every month. We had a clairvoyant who could talk to the dead. And one, we had a yoga instructor, we had a makeup artist, we had a lawyer. I just thought these are the things that women need to know about and gather about. And of course, we'd have wine and hors d'oeuvres. But now I'm thinking that I'm going to start. We have a lot of wineries that crept up around us. I still like the gatherings. I like an informal social setting for talking to women because that's so conducive. So now I want to start, or listen to this, Ava. It's called Wine, Women, and the Doctor. And I think in that kind of setting, going to a different winery every month, that we could just sit there and I would pick a subject and they could just talk to me openly. I find that once you let people know you're a gynecologist in outside setting, they have tons of questions for you. Tons. Yeah.
Well, Dr. Lara, you're in Ventura County. Ventura County in California, but are you able to see patients or consult with patients that are, done virtually?
Mm-hmm. I have a lot of patients. I have patients in New York and in Florida, in Michigan, and in Oregon, and probably some other states.
So awesome.
Yeah. We do. We tell.
In the Los Angeles Tribune, we always want to share, great resources, and good people and good news. And I've asked you a while ago, how can people get a hold of you? I'm putting it on the screen right now at the bottom.
Thank you.
Yeah, so you can check out Dr. Adrienne Lara. And she's got a beautiful name at her center. It's celebratingwomencenter.com. And you can also find her office's phone number there. And, Dr. Lara, we know that you have a patient in now. Thank you for taking the time. Thank you for taking the time to be on the broadcast with us. And we would be remiss if we had passed on the opportunity to have a woman who is creating legacy not be honored with us today. So let me just present you with the Luminary Legacy Award for Excellence in Women's Health and Empowerment to Dr. Adrienne Lara in honor of the remarkable contributions of a trailblazing woman in the fields of obstetrics, gynecology, cosmetic surgery, and women's sexual medicine. Dr. Adrienne Lara, your dedication to advancing women's health, your innovative approach to medicine, and your commitment to empowering women through education and wellness are at the heart of this recognition. From our CEO, Morak, and yours truly, Editor-in-Chief, and Alicia Magnus Lewis, our Director, Managing Director in the Los Angeles Tribune. We honor you, Dr. Adrienne.
Ava, Alicia, Mo, thank you so much. That was really unexpected. I will come anytime you want to speak on any subject. For anyone, women and men. I wanted to say I do have 300 men in my practice. And they came from the women. They wanted to say, could you take care of my husband? Yeah. And gladly I will. Yeah, gladly I will. Okay. That's
you
an
are
honor.
a true testament to expansion, growth, walking within and advocating for yourself. And we're so happy that you were able to combat having cancer and pour into your community, continue to pour in, continue to talk about education in the health and wellness space, and then also create spaces for women to just love the idea of being able to drink wine and talk about health and also just enjoy and have a good time. Mm-hmm. All of these things are important, but you've touched so many lives. The fact that one of your patients then led to legislation on how women deal with the after experiences of not having a child is so important. And so we just want to say that we honor the work that you're doing. We know it's hard, and we know that as much as it is joyous, there are difficult conversations, there are challenges, but you help women see themselves so that they can show up no matter what is going on in their lives. So we just thank you, Dr. Adrienne, for joining us today.
Thank you. It was my honor. Thank you very much for having me.
You already have questions in the chat, so we're bringing you back, Dr. Lara.
Okay, good. I want to speak more for you and educate more. I'd love to be. We did a good job today, you guys. We did great.
Thank you. And thank you for jumping in on your lunch break, Dr. Lara.
Sure. Anytime.
To our audience, follow us to another day of Her Story Unfolding, and please share this interview with Dr. Lara because it's very, very powerful. Have an amazing rest of your day. Thank you, Dr. Adrienne.
Bye.
Welcome to a celebration at the precipice of time, where the power of women knows no bounds. Experience her story unfolding, a reawakening of our collective consciousness to the monumental achievements of our foremothers, a tribute to the battles they fought, rights they've secured, and paths they've paved that women all over the world are continuing to navigate and expand upon. Her stories are unfolding, empowering growing, building legacies of pioneering women by sharing their stories, celebrating their accomplishments, and embracing the rights and privileges they've bestowed to us for generations to come.